Hi everyone, hope you are all fine and you are staying safe at your homes. And myself Ishnoor Singh, I'm student of the Department of Physiotherapy at SHRI University, SAHIB. And today's my presentation and demonstration is on the reflexes. Hope you will enjoy and you will clear your doubts and you will learn something. Let us start with the presentation reflexes followed by the demonstration within the presentation.
First of all, we talk about the introduction. Reflex activity is the response to peripheral nervous stimulation that occurs without our consciousness. It is a protective mechanism and it protects the body from irreparable damages. We'll talk about simple reflex arc. It is nothing but the pathway followed to give responses to a stimulus. So it consists of 5 major components: receptor, afferent nerve, center, efferent nerve, and the effector organ. So, first of all, if we talk about the receptor, it can be heat receptors, percussion, receptors for the vibrations, receptors for the prickling sensation, for the touch, for pressure, anything. And then the afferent nerve. Afferent nerve are those that carry impulses from the receptor to the center or the central nervous system. Then from the center, the efferent nerve exits. You always remember from the E, the word E, mnemonic. E means exit. Okay, it exits the center and it carries the nerve impulses or the message to the effector organ, that is muscle, which will be contracting. Image is showing the reflex arc, how the actually reflex activity works. So when you touch the hot object incidentally, then your hand is pulled back immediately. What is this? It is nothing but the reflex action. So it is totally involuntary action. It is not under your voluntary control. How it works? When you touch hot object, the pain receptors in the skin get activated and they carry impulses via afferent neuron, which is shown in the green in the picture, and to the spinal cord. From the spinal cord, the efferent nerve impulses are carried by the efferent nerve to the muscle, which make the muscle to contract, and the part being stimulated withdraws. Shows the components of reflex arc. A simple reflex arc includes 5 components which we have already studied in the last slides. The first one is the receptor, then the afferent nerve, then center, efferent nerve, and the effector organ. This is the slide showing the withdrawal reflex. Withdrawal reflex, it is also called cross extensor reflex. It is the reflex in which the flexors of the withdrawing limb are excited, means contracted, and the extensors are inhibited, while the opposite occurs in the other limb. For example, while eliciting the flexor reflex activity in a limb that is flexed, simultaneously the opposite limb is extended. The flexors are excited and extensors are inhibited in the limb, but the opposite limb, the flexors are inhibited and the extensors are excited. This type of cross extensor reflex is because of reciprocal inhibition. That is only the withdrawal reflex. The slide for the stretch reflex. Stretch reflex is reflex contraction of the muscle when it is stretched. It is also called myotactic reflex. It is the monosynaptic reflex and the quickest of all the reflexes. The extensor muscles, particularly the anti-gravity muscles, exhibit a severe and prolonged contraction during stretch reflex. Stretch reflex plays an important role in maintaining the posture. Talk about the tendon hammer. Tendon hammers, there are a number of tendon hammers like Trommer, Queen Square, Babinski, Tomahawk, or the Taylor hammer. So now, which we will discuss, this is the Taylor hammer.
Hammer which we are using is the Taylor hammer, and in this hammer it is the triangular rubber head followed by the needle which is being screwed, okay, and it is the okay. Then after that it is having another end which is having the brush which is used for the strokings, scratchings, okay, and the last one is the tail.
There are two types of reflexes, superficial reflexes and deep reflexes. Superficial reflexes are the reflexes which are elicited from the surface of the body. Superficial reflexes are of two types, mucous membrane reflexes and skin reflexes. Then deep reflexes are elicited from deeper structures beneath the skin like tendon. These reflexes are otherwise known as tendon reflexes. So these are the superficial mucous membrane reflexes. First one is the corneal reflex. The stimulus is irritation of the cornea and the response is blinking of eye. Then second one is conjunctival reflex, irritation of conjunctiva. Response is also same, blinking of eye. Nasal reflex. The stimulus is irritation of the nasal mucous membrane. The response is sneezing. The fourth one is pharyngeal reflex. Irritation of the pharyngeal mucous membrane is a stimulus and the response is opening of mouth. Ovular reflex, irritation of ovula. The response is raising of ovula.
First of all, we will talk about the superficial mucous membrane reflexes. In the superficial mucous membrane reflexes, I will demonstrate the two major reflexes, which are the corneal reflexes and the another one is nasal reflex. In the corneal or the conjunctival reflex, you have to use the cotton swab which should be properly sterilized, okay. The cotton swab should be sterilized so that in order to prevent the infections. With the help of cotton, we will open the eye from the lower eyelid and then gently you have to scratch. Gently you have to touch. It will see the action. It is blinking of eyes. So this is the last one was the corneal reflex. Now it is the nasal reflex. For that we will need the earbud. So for the stimulus, you have to irritate the mucous membrane of the nasal cavity, and the response will be the sneezing or irritation in the nose.
Slide, as we studied about superficial mucous membrane reflexes. Now, in this slide, we will study about the superficial cutaneous reflexes, which are the scapular reflex. The stimulus is irritation of the skin in the scapular space. Response is contraction of scapular muscles and drawing in of scapula. The second one is upper abdominal reflex. Stimulus is stroking the abdominal wall below the costal margin. Ipsilateral contraction of abdominal muscle and movement of umbilicus towards the site of stroke is the response. The third one is lower abdominal reflex. Stimulus is stroking the abdominal wall at the umbilical and iliac level. Its response is ipsilateral contraction of abdominal muscle and the movement of umbilicus towards the site of stroke. The fourth one is cremastric reflex. Stimulus is stroking the skin at upper end and inner aspect of thigh. Response is elevation of testicles. The fifth one is gluteal reflex. The stimulus is stroking the skin over the glutei. Response is contraction of glutei. Plantar reflex, the main and the most important reflex. Stimulus is stroking the sole, and response is the plantar flexion and adduction of toes. Seventh is bulbocavernosus reflex. The stimulus is stroking the dorsum of glans penis. Response is contraction of bulbocavernosus. 8. Anal reflex. Stroking the perianal region is the stimulus, and the response is contraction of anal sphincter.
So now we will continue with the superficial cutaneous reflexes, in which we will cover the two major reflexes. Those are the abdominal reflexes and the plantar reflex, which is the most important reflex used in the clinical practice. So for the abdominal reflexes, you need the brush, which is at the tail of the hammer. So with the brush, you have to slightly scratch the abdomen. First of all, at the lower costals. See, you will get the reflexes. The movement of the navel. See the reflexes. So now we will continue with the most important reflex, plantar reflex, which is also under the superficial cutaneous reflexes. In this reflex, you will have to use the tail of the hammer, or you can also use the brush given at the tail of the hammer. So in this, you have to scratch the outer edge of the sole of the foot, and with this you will get the reflex, that is the adduction of the toes and the plantar flexion. So see.
So the next category is deep reflexes. The first one is the jaw jerk. Stimulus is tapping the middle of the chin with slightly opened mouth. Response is closure of mouth. Second one is biceps jerk. Stimulus is percussion of biceps tendon. Response is flexion of forearm. Triceps jerk. Stimulus percussion of triceps tendon. Response is extension of forearm. Fourth one is supinator jerk or radial or periosteal reflex. Next is wrist tendon or finger flexion reflex. The sixth one is the knee jerk or patellar tendon reflex. The stimulus is percussion of patellar ligament, and response is extension of leg. The seventh one and the last one is ankle jerk or Achilles tendon reflex. The stimulus is percussion of the Achilles tendon. Response is plantar flexion of the foot.
Next, we will proceed towards the deep tendon reflexes. First of all, we will check the patellar tendon reflex. So for the patellar tendon or the deep tendon reflexes, we will need this hammer again, and you will have to put the gentle percussion single time. It will bounce back. Okay. So first of all, for the patellar tendon reflex, what you have to do is to see, here is the patella. So first of all, palpate the patella. Then there is the tibia. Between the patella and tibia, it is the patellar tendon. So when we will give the percussion on the patellar tendon, it will result in the response of the knee extension. Okay. See. So next, deep tendon reflex is the biceps reflex. For the biceps reflex, you have to first palpate the biceps tendon. Okay, so it will be in the. So ask the patient to flex the elbow tightly. So here is the biceps tendon. Okay, so when you will give the percussion on the biceps, so for this you have to little bit stabilize the biceps. It should be in the mid pronated position. Okay, and then you have to gently give the percussion on the biceps tendon. It will result in the flexion. Okay, but the patient's arm should be in the loosened position. Okay. See. So the next one is the triceps tendon reflex, in which you have to palpate the triceps tendon and you have to give the precautions of the triceps tendon, and the reflex will be extension of the elbow. So where is the triceps tendon? Triceps tendon is you have to stable like this, okay? And the triceps tendon is immediately above the olecranon process. So here. So the next one is the jaw reflex. What is it? In this, you have to ask the patient to open their mouth somewhat, little bit open mouth, and you have to give precaution on the middle of the chin. Okay, the reflex will be mouth closure. Open mouth. We will proceed on to the last deep tendon reflexes, that is the Achilles tendon reflex, in which we also again need the hammer. So in this reflex we will have to palpate the Achilles tendon first, then we have to give the percussion, slight percussion as used for the before. The way is same, the percussion on the Achilles tendon, and the reflex will be plantar flexion.
So now, there are number of pathological reflexes. Well-known pathological reflexes are Babinski sign, second is clonus, and third is pendular movements. This pathological reflex is Babinski sign. Abnormal plantar reflex is called Babinski sign. It is also called Babinski reflex or phenomena. It is named after the discoverer Joseph Babinski. In the normal plantar reflex, a gentle scratch over outer edge of the sole of foot causes plantar flexion and adduction of all toes. But in Babinski sign, there is dorsiflexion of great toe and fanning of other toes. Clonus. Clonus is the second pathological reflex. Clonus is a series of rapid and repeated involuntary jerky movements which occur while eliciting a deep reflex. When a deep reflex is elicited in a normal person, the contractions of a muscle or group of muscles are smooth and continuous. But the clonus occurs when deep reflexes are exaggerated due to hypertonicity of muscles in pyramidal tract lesion. Pendular movements is the third pathological reflex. Pendular movements are slow oscillatory movements that are developed while eliciting a tendon jerk. Unlike clonus, pendular movements occur because of hypotonicity of muscles. Pendular movements are very common while eliciting the knee jerk or patellar tendon reflex in the patients affected by cerebellar lesion.
So the next we are going to demonstrate is the Babinski reflex or the Babinski sign, which is based on the plantar reflex, and it is the one of the most important pathological reflex always seen. In this, it is opposite to the plantar reflex. As in the plantar reflex, there is adduction of the toes and the plantar flexion, but in the Babinski sign, there is the dorsiflexion and the abduction or the fanning of the toes. So, how will we check? The same procedure as we checked about the plantar flexor reflex. See, dorsiflexion. So I hope you all understand the topic, and I think you well known about the reflexes now, deep reflexes, how to check the reflexes, how to check the pathological reflexes. Okay, so now I would like to advise you that you should do practice at your homes with your elder ones, so that you can get to know about the reflexes very easily, and These reflexes only you can gain by the practice. Okay, so thanks for watching the video, and stay home, stay safe. Thank you.